One of the more frustrating aspects of dentistry is dealing with insurance companies and claim denials. If claims are constantly delayed or denied, your dental practice is missing out on money it has earned. But don't worry, this video will go through 10 reasons your claims are being denied and what you can do. If there's anything we at Dental Claim Support understand, it's the frustration of a denied claim. That's why for the past 10 years, we've made it our mission to help dental practices get their claims appealed and paid for your dental practice. Claims are usually denied because of small, easy to miss mistakes. Once you realize how easy these mistakes are to make, you'll also see how easy they are to fix. This video will cover 10 reasons your claims could be getting denied by insurance for reimbursement. And by the end of this video, you will know what you can do to fix and even avoid these denials. Number 1, incorrect dental codes. In order for a dental claim to be processed properly, it's necessary to include the correct current dental code set to identify the diagnosis, service rendered, and procedures performed. This could either be a CDT code or an ICD-10-CM. Making mistakes on codes is probably the easiest mistake to make because codes are hard to keep up with. They update and change every year. Here's what you can do. Make learning the dental codes your priority. Invest in your education of CDT and ICD-10-CMs to avoid making coding mistakes. You can enroll in Dental Claims Academy to deep dive into your dental coding education. Number 2, outdated insurance claim forms. Dental insurance companies will update their claim forms and what information is needed from time to time. It's important to stay on top of this when it happens so you're not sending out outdated claim forms that lead to denials. Here's what you can do. For a smoother and possibly quicker process, always use the most recent version of a claim form. If you're having doubts about which version of a claim form to use, call the insurance company and double check. Verifying which form to use when sending a claim might take you a few minutes on the phone versus sending the claim on the wrong form and getting it denied, then having to resubmit the claim. Number 3, incomplete or incorrect information on dental insurance claim. This might seem like a no-brainer, but it's one of the more common ways that dental insurance claims are denied. It's pretty easy to misspell someone's name, input the wrong insurance number, or any kind of input error. It might not even been an input error. Maybe your patient has updated some of their information and didn't tell you. Here's what you can do. Make sure whoever is responsible for creating and sending claims is not distracted by anything else. They should always have time set aside dedicated to accurately filling out the claims. When we say have the time, we mean they do not have any other pressing responsibilities that could distract them or take them away from time spent accurately creating, batching, and sending claims. Number 4, not reviewing patient benefits. Insurance verification. This goes hand in hand with the previous issue. It's good practice to have your receptionist ask for a rundown of the patient's benefits. Although their insurance company may be the same, the benefits and/or group number may be different. Here's what you can do. A key step to making sure insurance claims are not denied is insurance verification. Reviewing a patient's benefits before they enter the office is the best way to make sure all the information is up to date, their benefits are still active, and just how much of the procedure their insurance will cover. Number 5, unreadable information and files. As insurance companies and dentist office transition to electronic information, a common problem that arises is unreadable information and files. If the writing is too light or smeared or simply illegible, this can result in an insurance claim delay. Here's what you can do. A great way to ensure your claims aren't denied is by having great quality images and x-rays attached to your claim. An intraoral camera can help with this. This camera will produce a color photo showing what the naked eye sees. Therefore, it clearly conveys the condition of the patient's mouth, which of course is always needed for an insurance claim. Also, when submitting x-rays or charts, be sure to send the correct version. Also make sure that they're mounted, labeled right to left, and readable. Number 6, missing tooth clause. In this situation, a patient comes into your office with a missing tooth, claiming that he has dental insurance. You file the appropriate insurance, but the insurance company denies the claim because the missing tooth was extracted prior to the patient's dental coverage and its replacement is not a covered benefit. Here's what you can do. The best way to avoid this issue is to know the patient's benefits before doing anything, especially complex procedures. This goes right back to the insurance verification. Make sure you and the patient aren't missing any fine print information, specifically about the time during which the tooth was extracted. Number 7, contractual denials, clinical and limitation. Contractual clinical denials occur simply because some contracts don't cover certain services. Usually non-covered services include cosmetic procedures. Contractual limitation denials are delayed or denied due to limitations in the contract based on age, frequency, or waiting periods. Here's what you can do. Not only do you need to verify the patient's insurance benefits before the procedure to make sure the benefits are active, but you also need to understand what will and will not be covered. If a patient wants a teeth whitening procedure done, you need to see if their benefits will cover a cosmetic procedure such as this. You also need to understand the rules of their benefits as far as frequency and waiting periods go. It falls on the shoulders of the practice to know the ins and outs of the patient's benefits because patients will likely never fully understand their own benefits. It's an unfortunate truth. Number 8, no explanations on the claim form. If you can't explain or document a reason why a procedure needs to be done, chances are slim that the insurance company will approve the claim. You must always have an explanation of why a procedure was performed, and this explanation must be detailed and personal to each patient. We see offices have claims denied because they use stock narratives on their claim forms. This means a pre-written or default explanation of why a treatment was needed. Make sure you avoid this as well as leaving it off the explanation altogether. Here's what you can do. We've said it before and we'll say it again. Make sure one person has the time to be dedicated to creating the insurance claims. Neglecting to add an explanation of treatment to a claim forms or adding a default explanation is a really quick way to have your claim denied. Make sure the person responsible for the insurance claims isn't forgetting crucial information due to being spread too thin at the office. Number 9, no student verification. Inadequate documentation of a student's status often leads to denied or delayed claims. And you guessed it, this goes right back to insurance verification. If the student status of a patient is going to affect their insurance coverage, it's important you review the patient's benefit plan to better understand it before the procedure. Here's what you can do. Ask the patient's insurance carrier to gain a better understanding of what information you'll need regarding their status as a student. Like I said, it only takes a few minutes to call the insurance and ask a simple question of how their student status will affect their benefits versus waiting to receive a denied claim and resubmit a new claim in order to have it paid. We're talking minutes versus weeks. Number 10, trying to juggle everything. Last but not least, claims are denied because the person or people responsible for sending claims is juggling too much. Mistakes happen and everyone is human. Filling out claim forms is a tedious task, and making sure they are batched and sent accurately is a time-consuming process. If you're also trying to check in patients, answer phones, or keep up with a schedule, it's easy to make those mistakes. Here's what you can do. There are really only 2 options here. You can either hire an insurance coordinator whose only job is handling your insurance billing and will not have any other responsibilities, or you can outsource to a dental billing company where a billing expert will dedicate to getting your office's claims paid. You now have a better understanding of why some of your claims could be getting denied by insurance companies and how to combat the cause of denials. A solution that could help all dental practices, big or small, would be having a single person dedicated to your practice's insurance billing. This could be a full-time insurance coordinator or an outsourced dental billing company, like us here at Dental Claim Support. To help you with that decision, we have a savings calculator tool to help you when looking at outsourcing your dental insurance billing. Link in the description below for that calculator. And if you have any questions at all, click the other link in the description to schedule a free call with us. And as always, hit that like button, subscribe if you're new, and hit that bell icon so you don't miss out on any new videos.